You're good to go, Karen.
Great. Thank you, Jim. Well, good morning, everybody. It's nice to see some of you on the Google Meet, and I know a lot of other people are watching on the YouTube channel. So I just want to welcome everybody back. It seems like a very long time since we've been in school and we've been able to see each other. We see a lot of each other virtually on our meetings since March 13th. But, it just feels really good to be starting a new school year and try to get back to some routine. So with that said, I hope everybody had a great summer. Just like everything else in our lives right now affected by COVID-19, I'm sure your summers were different to some extent. You probably didn't do the typical summer things you might do with your family, but I do hope that you were able to do some of them, if not all of them, and it mostly takes some time to relax and regenerate and just enjoy your family and friends. We can't underestimate what we're going through, that we're still going through, that started last spring, and we're learning a lot as we go, adjusting as we go. There's been challenges along the way as we go, but we're learning a lot. And I think we've grown and, we've been able to think about how to do things. We've had to think about how to do things differently. And in a lot of cases, I think better. So I just welcome everybody back. Thanks for being here this morning. I'm not going to take a lot of time this morning because we do have a full day and a full opening session here. So I just wanted to mostly thank everybody who spent time over the summer planning, preparing, and getting ready for today and for next week when the kids come in. As you know, as we've talked about and have tried to provide updates throughout the summer, our guidance, the rules, the regulations, and everything we needed to do to open school this year, most of that came very late to us starting in July and changed frequently, sometimes weekly and sometimes daily. The things that we learned about changed. So we really learned about what thinking on your feet means this summer if we didn't already know before. So I really want to thank everybody who dedicated their time, gave up vacation time, gave up time with their family and their friends just to make sure we were where we are today. And again, be ready for the kids next week. From the district administrative team, the building principals, teacher leaders, the PDA, countless teachers that have devoted their time. We would not be here. We would not be able to even attempt what we're going to try to do next week with the kids and the staff if the people who didn't give us their time this summer, if they didn't do that, we wouldn't be able to do this. And equally, I'd like to thank both unions, the Teachers Alliance and Council 94. Without your commitment to the kids and the families and the staff in the district, we would not be able to even think about what we're doing. Your flexibility, your willingness to consider adjustments to the contract have allowed us to really serve our community. I know a lot of districts are doing a lot of really innovative and creative things. I really don't know, as usual, any other district that's attempting what we're attempting. And it looks like we're going to be able to pull off with success. We're really servicing the families of the district. We asked people what they needed, whether that be full distance learning, the hybrid model in every other day, or if they needed their student in 4 days a week for whatever reason. And we were honest on the survey. We even asked people, is it a child care issue? Do you need your child in school 4 days a week so you can go back to work? And we're lucky, our numbers worked out. There's so many families that want their kids to stay home and do distance learning. We had room in our buildings to bring in more of the kids. So without all of those collective pieces, collaboration, willingness to be flexible, we wouldn't be able to offer this to our families and our kids. So from the bottom of my heart and on behalf of the school committee and the district, I thank everybody that's been involved in this process. And it's a challenge. I mean, we certainly have a lot more to do. We certainly will have things to iron out as school starts. but I think we have a lot of momentum, and I know we're in a groove where, just as always, if we work together, we can overcome any challenge. So with that said, we've really redesigned our district in a matter of weeks. We've had to redo building schedules. As you all know, building schedules start in the spring. So the principals had all of that work done, and then literally in the summer, were asked to redo their building schedules with 3 different models. So it's really like 3 different schools, if you will. So that's amazing when you think about it. So with that said, we do have a lot to talk about today, so I just want to move along. Becky Handy, we all know and love Becky. You see, when people retire, we always say this, we really don't let them go, so we always find a way to reel them back in. So Becky's been kind enough to join us again this year. As a requirement, the district needed to appoint a medical point person for COVID-related issues specifically. So Becky's been hired to work with us this year to be the liaison to the Department of Health and RIDE. And Becky's going to talk in a few minutes about things are changing still, as the science evolves, as the CDC comes out with new information, as RIDO comes out with more information, Becky's role is to keep up with that and to come back and inform us all. So Becky will play a critical role in our health and safety process this year. And I'm just going to back up for 1 second and just say, every single decision we've made this year has been with health and safety in mind. So whether it's class size, protocols, arrival and dismissal processes in the buildings, PPE, sanitizers, air quality, everything we're doing has been with health and safety at the forefront. And if we didn't feel like we crossed that hurdle with whatever topic we were working on, we kept at it until we were able to do that. So I just want to make sure everybody knows that is where we started. So with that, I'm going to introduce Becky. And then after Becky, we have a special guest as a keynote speaker today. So Becky, if you want to jump in.
I sure will. Thanks. Hello, everyone, and good morning. It's nice to be working back with you again. So I'm going to go over a few of the things. I'm sure you've all heard about that crazy thing out there called COVID. It's made a big change in the way that we do some things. Some of the things that we're changing will stay, like after we get the vaccine. So it's good that we're making some changes. Some things will end up going away, but we're just going to have to do the best we can to sort of keep abreast of how things are happening. And some of the things I say today will actually change at some point. So if you have concerns and questions or anything regarding COVID, you should bring them to we follow the chain of command. You should bring them to your principal, and then, your people talk to my people, and eventually it gets to me and we sort of figure out what it is that we're going to do. We will solve our problems. One of the things we have found about COVID at this point is that actually there seems to be a trend towards it being more concerned with droplets rather than exactly surfaces. That sort of is a developing information as we go along. So that also will probably change. The best way to treat COVID is to prevent it from happening. The best way to do that is to do the 3 things: wear a mask, socially distance, and do frequent hand washing and sanitizing. So a couple of things on masks. The things that we do have in the school, we do have some cloth masks that we can give to people who might have forgotten theirs or might need one. You also can wear those surgical masks. You actually can buy them at Stop and Shop. If you are make a mask, it should have at least 2 or 3 layers of fabric in it. The things that are not allowed are those gaiter things and bandanas and those those masks that have like one like a opening in it, like a one-way valve that just spits out the droplets. We're trying to avoid those. We don't want that. The bandanas and the gaiters have not been proven to be effective, so they are not allowed in school. So people in school are required to wear a mask by district and by state, students and teachers. If you are going to go without wearing a mask, that kind of has to be like a private thing when you're private and sort of by yourself. There are some exceptions to wearing a mask, and that does go along with like people who might have medical or emotional issues. Usually our special ed kids is who that usually involves. And in those rooms, there might be more leeway than there are in the typically developing classroom. But in the typical classroom, students are expected to wear a mask. And if they don't want to, then we have to have someone talk with them about maybe distance learning is a better option for them. But that is the best way to prevent COVID, is to wear a mask. And I do want to talk a little bit about, if you do use a cloth mask, there are ways to clean it. You can throw it into the laundry. You can also make a bleach solution, soak it for 5 minutes. I think it's 4 teaspoons to a quart of warm water. Soak it for 5 minutes, dump the bleach, rinse it out with cool water, get it to dry. A lot of this information that I'm giving to you today has come from CDC, which is Centers for Disease Control. CDC.gov has a ton of information, more than you ever wanted to know, actually. And also the RIDOH, Rhode Island Department of Health, or RIDE, who you were all familiar with. So when we talk about people socially distancing, we are saying stay at least 6 feet apart or greater. And if you do come in contact with a student, like if in the classroom, if you are doing something with a student and you are closer than 6 feet, then keep it under 15 minutes. That's what is recommended. When we talk about hand washing, we talk about soap and water, 20 seconds. Make sure you do all surfaces, tops, bottoms, in betweens, do your nails. And soap and water is preferable to sanitizing. Soap and water does a little better job than sanitizing. If you soap and water and then sanitize, you've actually beat the standard. So good job. There's nothing wrong with that. If you don't have soap and water, sanitizing is okay. I do want to say that each school has a designated isolation room, and those rooms are intended for students who are sick or considered probably sick with COVID. The state has given us a list of symptoms to go by, and the students will go to those rooms until they are dismissed. And first of all, they will go to the nurse for eval, and then by way of the nurse, go to the isolation room. So any student in the isolation room has to be supervised. They need to be visually supervised. You could have that child in the classroom, in the isolation room, and whoever is supervising could be outside of the classroom, outside of that isolation room, and does not need to go in unless they need to go in, but you don't need to go in. But I'm sure there's going to be some, emotional things and considerations. You certainly want to talk to that student. Anybody who is supervising is considered what we call full PPE, which is personal protective equipment, which is, face shield, masks, gowns, gloves, just for safety. If you've not been in that room, then you are able to move around the corridor with your PPE. If you have gone into the room for any reason you're considered contaminated, sorry guys, not being mean, just telling you the truth. We all do this as nurses. You are considered contaminated. And those, before you come out of that room, those equipment things do need to be left inside the room. I want to just say one thing about the isolation rooms is that they are set up with what we call negative pressure, meaning that we're blowing air out into the outside. And so with that in mind, fans in the classroom are not recommended or allowed at this time, because if there are droplets around, they just throw it all around. And that's not a good thing. We're trying to avoid droplets, which is why we're telling you wear a mask, socially distance, and hand wash and sanitize. So if you do feel a need for a mask, that would again go to your building principal and your custodian, so we can figure out what the best thing is to do as far as that goes. I did want to say a word about PPE, and if I had really thought this through, I might have done a word of the week for you guys, like donning, doffing, attestation, Didn't get that far, sorry. So PPE is considered, actually masks are considered a standard. They're not considered PPE. PPE refers more to like the shields, the goggles, the gowns. If you option to wear a face shield, which is a way to protect your eyes, just understand this, that is not a replacement for a mask. You also need to wear a mask. They have not, by CDC guidelines at this point, meaning, yes, it can change, but at this point, they have not been shown to be effective in reducing droplet transmission. So, so if you do wear a shield, at your own choice, you also, in the classroom, you also need to wear a mask to go with that. Goggles are, again, out there for protecting eyes. Goggles and face shields are the two PPEs at this point, which can be reused. They need to be cleaned and disinfected prior to reuse. That might be something, if you're wearing it in your classroom, to do at the end of the day. Soap and water, and then something like an alcohol, something with like alcohol to sort of cover over the face shield, and that will help to reduce any sort of like a disinfectant, you know, and then leave it out to air dry, and it's ready for you for the next day. And I don't think I mentioned this with hand sanitizers, but they should be about a 60% or greater alcohol. I'm sort of buzzing along. I've got a bunch of papers here. I think I just want to say another word about attestation, which is a word that I had never even heard before, but now I'm hearing it a lot. So what this really means is that we are asking people, all of our staff, and also our parents, and also our visitors, if we have any visitors, to attest to the fact that they are asymptomatic, they have not traveled, they are not feverish. And the staff will be expected to do this every day that they are planning to come to work into the school building. And I would just say, feet on the floor and give yourself a once over focus. How am I feeling today? How am I doing? You know, and if you're feeling at all sick, we love you, stay home. We'd love to see you, but honestly, not if you're sick. We really don't want to have anything that could be spread. And to be honest with you, the only way that we really know if you have COVID or not is by a test. And so if you are symptomatic, we're asking you to stay home until you are not symptomatic. And if you have any questions about coming back to school, you can, again, go through the chain of command and contact me, and we can have a chat about it. So there is going to be a form on Aspen for all faculty and staff to complete every day. And I will be looking at those and every day, and we'll be just looking to make sure that everybody's in good shape when you come to school. We are expecting parents to do that as well. We'll try to alert teachers for students whose parents may not have done that, and sort of figure out the best way to help the parents to get to the point that they do that regularly every day. We want these kids ideally attested that they are okay, symptomatic free, fever free, to come to school before they get on the bus, before they get dropped off, before they start to walk, whatever it is. And I have sort of buzzed through that. I developed some protocols which will help us to sort of also get through the day. Those will be gone over at a different moment. And right now, I think that's all that I need to say. So nice chatting with you, and I hope to be seeing you all at some point. Thank you.
Great. Thank you very much, Becky. I just wanted to follow up on just a couple of things. And as Becky just said, there's going to be much more information regarding protocols in the school, in the buildings in a typical school day, in terms of if a student's in your classroom and they present with symptoms, what's the protocol? Or if a staff person, presents with symptoms or develops symptoms during the day, what do we need to do? So the principals and school nurse teachers will be presenting all of that at the building level. I did just want to follow up on the child piece. If a student comes to school and the parent has not filled out the daily attestation in Aspen, again, this will be gone over at the building level. I just wanted to take a quick note about it right now. What the protocol will be, what we've decided will happen is the student will go to their first landing spot, wherever that is, at their classroom, their first period class, wherever they go first. And the teacher will, as they do their daily attendance, they'll get a report or be able to see in Aspen what kids don't have the daily attestation done by the parent. And the teacher will be asked to do just a verbal and a visual screening of the student, not take a temperature or anything like that. If there's any sign or symptom, the child isn't well, doesn't feel good, the student automatically gets sent to the clinic, and then the school nurse teacher takes it from there. So that should all happen within the first 15 minutes of the class. And this was back to another point Becky made. We hear a lot of terms, a lot of definitions, and that you hear more about when we go over the protocols. A close contact is somebody that is considered you've been within 6 feet of for 15 minutes or more. So if a student, the reason we're going to have this done at the very beginning of the day, as soon as the kids land in their first landing spot, is because that should be able to happen within the first 15 minutes of the class. So technically, by definition, those students wouldn't be considered a close contact. So in very brief, that's how that's going to be handled if a student does not have the daily attestation done at home. But again, more to come about that at the building level. And I just wanted to backtrack to the facilities piece for a minute and give a huge shout out and thank you to Ken Townsend and everybody in property services. The facilities piece is the latest that came at a very short notice just a couple of weeks ago. And then the state had these walkthrough inspections that happened just last week. A tremendous Kenny and Property Services always puts a tremendous amount of work in, always, but especially over the summer, to make sure our buildings are healthy and safe. We are always at a bare minimum and usually above code and standard for health and safety in terms of air quality, ventilation, our HVAC systems, and all of that. So on top of all of that, Kenny really went above and beyond at a very short notice in the past 2 weeks to make sure our buildings are healthy and safe, and they are, and we passed our inspections and we're good to go. So I just wanted to make a note about that. Okay, I just wanted to follow up with those two quick things. So Becky, thank you very much. Again, any questions, concerns, you can let your building principal know. She'll follow up with Becky, and then we'll go from there. So thank you very much.
Great.
And with that, we have special guests today. We have got a couple of visitors from Polaris Consultants. We have Dr. Daryl Appleton and Ms. Jennifer Weaver, and I see that they're both on the call. So welcome, and thank you for being here with us today. And they are from Polaris Consultants, and they're going to give a keynote address regarding resiliency, self-care, mental health concerns that, we started out this session by saying, and we're living it every day, what a crazy time this is. And it's an overused word, but unprecedented. And I try not to use the buzzwords too often, but, we spend a lot of time thinking about the care of our students and families. And I think we need to remember, we need to include ourselves in that conversation as well. So we thought this was a very appropriate presentation. So Dr. Appleton and Ms. Weaver, thank you very much for being with us today. And I'll turn it over to you.
Thank you so much for having us. Can everyone hear and see us? Perfect, good. Jen is going to pull up our PowerPoint. We are on top of things. We feel very tech savvy in this Google Hangout with all of you. But we're really excited. I think that so often we don't think about ourselves when we're caretakers. You are very much caretakers as much as we are as therapists. So we put together this presentation with teachers in mind And we really wanted to talk about how to manage change through resilience, not only in your classroom, but also in your lives. So Jen and I, when we were thinking about how to name this presentation and how to, put it in a context and a format that made sense, we really came up with the title of "There's No Such Thing as Normal Right Now." And this is going to be something that you're going to tell your students. This is going to be something that you're going to tell yourselves. So if you can get anything out of this presentation, and I guess I'm bearing the lead here, it's that there's no such thing as normal and change. But Jen and I will go through some really great tangible skills that you can do for yourselves and also model behaviors for your students and, significant others. Everything kind of falls under this. So we're really excited to share this.
Okay, so I'm gonna go ahead and get started. Daryl, can you see? I can't see anything, so can you see the keynote?
Yep.
You can see it? Okay, cool.
You're looking good.
All right, perfect. Okay, so this is us. Typically, we sort of explain who we are a little bit. So Daryl and I own a private mental health practice and consulting firm in Rhode Island. We have a few locations. It's Polaris Counseling and Consulting. We've been business partners now for about 6 years, and we are lucky enough to split our time partially between private practice and partially between contract work and providing trainings and consultations like we are with you today. So we will show the slide again at the end, but we always encourage people take a picture of it quickly before we move on because it has all of our contact information. And if you have any questions that sort of pop up at 3 a.m., which is when some of the best questions do, send them along. We certainly will not respond to them at 3 a.m., but get them out of your brain and into your phone, and we will respond the following morning.
Perfect. And I know as teachers, some of you might be type A like myself and want to know what we're doing and what the format is. So this is going to be very quick. We're not going to talk your ear off. We're, have about 45 minutes or so, and we're going to leave time for questions. But we're going to talk about what is normal and change. We're also going to highlight some of the things that could be red flags in changing, again, for yourself and potentially in your classroom or people around you. We're also going to talk about the mechanisms of growth and change, which is very structured, and it's an interesting theory. And again, we will make it as wonderful as possible and not boring at all. And then we're going to talk about our top 5 resilience factors in change. So out of everything, Jen and I broke it down of all the people we see and talk to on a daily basis, what would be our top 5 things that we can leave you with to help in this time of change. So if there's any questions, let us know. We can also save them till the end. We're okay with either.
And I know, and I may be wrong in saying this or incorrect in saying this, but I know there's some people watching potentially through a live stream on YouTube, so we won't obviously be able to see those questions. So if someone wants to just raise their hand or speak over us, I won't be able to see you, but Daryl will, and then you can just present us with the questions if they pop up in the middle of the presentation.
Perfect. So my good people of the chalk, what is normal in change? And when we talk about, again, normal in any capacity, it has a range. When we're talking about a pandemic, when we're talking about things that are unprecedented in our world, things like crying, confusion, feeling great, not sleeping at all, excitement, yelling, all of this is incredibly normal in change. And I'm sure some of you with young children or working with younger students, you're going to see this range a little bit more externally, because for young kids, they don't have the capacity to talk out their feelings. Their brains aren't fully developed till about 25, so quite a long ways to go. But they are a little bit more reactive to change. But for us as adults, it doesn't mean we don't feel these things. So we really wanted to highlight that what is normal in change is that you are going through something, and to be incredibly kind to yourself as you're going through it, because change manifests very differently for all of us. And we really kind of push our clients and for you guys as well to think about how this change has manifested in your life. And if you're saying that everything's been great and nothing's been changed at all, I'm going to call you a liar, and really kind of push you to think about what has this done to your psyche? Because in order to fix something, in order to get better with something, we need to know where it doesn't feel good. We need to know where the hurt is or where the sore spots are. And again, there's no such thing that is normal right here. And Jen, I know you're going to talk a lot about the things that aren't so normal. So maybe you want to highlight some of those things.
Yeah, I think when we sort of look at and I'm going to just flip back to the previous slide just really quickly, but I think when we look at what's not normal, we want to look at what is beyond your baseline, right? So we're all experiencing some level of anxiety right now. For some of us, that's incredibly minimal. For some of us, that's really high. It's kind of about looking at what does your anxiety look like when you are experiencing anxiety. Mourning what was, it's kind of this what's normal versus what's not normal. So we're hearing a lot of, it's like a really popular meme right now, like welcome to the new normal. And I hesitate when I see that because, first of all, we don't know that this is the new normal. We know that this is the now normal. We know that this is the current normal. We don't know that this is the permanent new normal, but also like mourning what was. If getting with the changes and not being able to step past sort of what we're mourning and getting into the new stages, that may cause some difficulty for people. So it's all about your baseline. If you're noticing that your anxiety, your need for space, your mourning what was, your sleep, your elation, your crying is beyond your baseline, I think that's when we're talking about what's not normal. And that's when potentially you want to reach out to somebody like ourselves.
And to be fair, if you're somebody that cries a lot and
Right.
you find yourself crying, that is your baseline. If
Right.
you find yourself crying more, and it's getting in the way of you, you're picking up like cereal at the store and you're just sobbing. We want to talk about that if that's not something you normally do. If, whole grain cereal moves you in, the supermarket, that is okay if you're, tearing up at Cheerios. But if it's not, that is something that's changing.
Right. Okay, and this I forgot the slide was here, so I went backwards before, but this is essentially what we were talking about. What is healthy versus unhealthy and change? And aside from your baseline, what we really want to look at is anything that inhibits your functionality. So if at any point you are finding that you are having difficulty connecting with your loved ones, if you are having difficulty getting tasks done, if you are having difficulty getting to work, doing your job, anytime something affects your functionality, that's really when we want to sort of focus on it and sort of take a step back and say like, okay, what does that mean for you and what potentially needs to change? Daryl, any feedback on that while the garbage truck goes by my house?
No, the next slide I think has some cool bullet points though.
Okay. Just gonna load a barrel right now during a presentation, so I apologize.
So
Okay.
when we are talking again to break down these healthy versus unhealthy, and Jen said a lot of this, but again, when we're thinking in the context of ourselves, are these symptoms manageable? Should be your first question.
Right.
Meaning, is this impacting my daily functioning to a point where I can no longer concentrate during lesson planning? I am not listening to my significant other when they're talking. Again, change comes with symptoms. We're not trying to avoid symptoms when change happens. We try to embrace them and put in coping skills. It's when they become unmanageable and that dip in baseline tends to creep up that we get a little worried. Other things that are healthy and quote unquote normal in change are there intentional coping skills? And sometimes this looks like planning. I'm a planner, so I like to have a plan for things. But sometimes it's also planning to not plan, which feels interesting to say. But sometimes that means today I'm not doing anything. Right. Today I am going to just go to the grocery store and I'm not checking my email. These are all healthy ways to manifest or to break down the manifestation of change. Feelings are also incredibly healthy during this change. If you have no feelings during a pandemic, I want to talk to you for a million different reasons. Because it's either going to come out later on, which is going to explode all over some 8-year-old or, at your significant other, or it is something manifesting deeper that you're not allowing yourself to process. The unhealthy things, and this again can be for you, it could be for your students, it could be for your family or loved ones. Again, the rise and dip in baseline that is severe and persistent. So a bad day is not unhealthy. A bad month is. So we want to really make sure that we're being appropriate with ourselves too, that you're allowed to have a bad day, but if it's persistent longer than, like, I would say 2 weeks, you might want to talk to somebody about it. If you're hurting yourself and others, and this doesn't just mean self-harm in the very clinical sense, this also means I'm eating to the point where it's unhealthy, or I'm not eating to the point where it's unhealthy. This could be I am lashing out at other people unnecessarily. I have very little patience for my grandchildren, or I have no patience for my significant other. I am, verbally kind of attacking people in the Dollar Tree that I normally wouldn't. Things like this of hurting yourself and others, it's unhealthy because that stress and that manifestation of change is not sitting in a healthy place with you. Also, these self-destructive patterns, and they could look like I am pushing off my work and I'm not getting anything done. This could be I am working around the clock and not giving any breaks for myself. This could be self-destructive patterns of alcohol and drugs. It could be anything in the range of something that if you ask yourself the question, is this helping or hurting me? If you don't have a clear answer, or if the answer is it's hurting me, then I would argue that is unhealthy. And Jen, anything you want to add on that?
Yeah, I just want to highlight feelings. And I just want to sort of, I'm lucky enough to have a handful of teachers on my therapy caseload right now. And I think one of the things that we've been highlighting in sessions is it's normal to feel all the feelings you are feeling right now. So if you are feeling angry that you're going back to school, full time, you get to feel angry. If you are feeling confused about going back to school full time, you get to feel confused. If you're noticing that your coworkers are feeling angry or confused, but you feel excited, you get to feel excited. And I think when we look at the other side of the slide and we look at those self-destructive patterns, it becomes self-destructive when we do not allow ourselves to feel the things we are feeling. So I think part of this entire change is you are probably going to feel a litany of feelings, and you are supposed to. We are human beings. It is rare that we feel one thing and only one thing. So feel what you are feeling, acknowledge that you are feeling it. It could be self-destructive to potentially dwell and stay in that feeling, but it's also certainly self-destructive to not acknowledge or not allow yourself to feel that feeling. So I think there's a balance there. Feel the things, but don't drown yourselves in them.
And I would argue as coworkers, as a support system of teachers and staff and administrators, allowing each other to have those spaces to feel feelings where it doesn't get toxic. So you're allowed to vent. Jen and I usually joke, even in our meetings with each other, if you vent about it for more than 15 minutes, then you're complaining. You can vent for 15 minutes about how awful this is, but if we're going past the 10-15 minute mark, now you're just complaining and it's getting unhealthy and toxic. So as staff, as coworkers, to really hold each other accountable and allow each other to feel our feelings, but say like, right, but there's nothing we can do about it right now. What else can we do instead? Because we're just bringing down the day right now. And that's an incredibly healthy way to attack this as a group as well.
Right.
So again,
go ahead.
Go ahead, Jen.
I was going to say, you'll notice that this is a very similar, this is the same slide we posted earlier, and that was by intention. Obviously, it's this idea of all of these things can be healthy, but they also can be unhealthy. So if you are getting less sleep, maybe because you are excited or you are ready to go back to school, or you potentially need an extra night to plan your lesson for the next day, sure, at a minimal amount, that's relatively healthy because potentially you're being more productive. And by not sleeping at all, I do not mean like literally never closing your eyes and seeing the sheets on top of your mattress. But I mean, if you normally are an 8-hour sleeper and you maybe get 5.5 one night because you have a lot of stuff to do for work, okay, maybe that's relatively healthy because you're being productive. If you do that every night for a week, it's absolutely not healthy anymore. I'm going to therapy, incredibly healthy. I'm obviously a huge proponent of it. If you call me every day, we have to have a conversation because potentially your reliance on therapy has bordered into the unhealthy zone. And Daryl, I don't know what your take is on some of these.
I agree wholeheartedly. At the end of the day, we want you to self-assess. Change is about understanding who you are in the midst of change. And if we can give you clarity on that, you will help yourself from avoiding some very dangerous things down the lines. Anxiety, depression, these are things that don't just creep up because of genetics. It's absolutely, it plays a part. But neuropsychologically, when we talk about these clinical diagnoses, anxiety grows. It's like mold, and it doesn't just clear up. It's not a zit. It's not like you just wake up, you put some cream on it, and it's good. If you're finding yourself more anxious, more depressed, this is something that needs to be addressed. You're not crazy. You're not going to Butler quite yet. If you want a vacation, we can plan it there for you if you really want to. But we're talking about how to make sure that you put your air mask on first before assisting others with theirs, especially as teachers and especially as caregivers in your own lives. It's incredibly important.
Right. So we're going to talk a little bit about the mechanisms of growth and change. These are probably things you are fairly familiar with through your education degrees and any of the psychology classes that you took. So we will, try not to spend too much time on this.
So why is change difficult? And for therapists, we love change. We think change is wonderful and we embrace it. That doesn't mean we do it in our everyday lives, but professionally, we love it. Change is hard because sometimes we're not ready to change. I would argue that no one was ready for this change. I would argue that if we polled all of you right now, a lot of you would feel very differently about the change of going back to school after being out of it. The readiness to change sometimes makes it very difficult because it's asking yourself, do I have the resources and knowledge to make lasting change successful? And when we're talking about individual change, that the question might be a little bit easier to answer. When we're talking about it systemically, or when we're talking about it from an organizational standpoint, that might be a little bit harder because there's more moving pieces. So understanding that your readiness to change is also something that could make change very difficult, and addressing that and thinking about that as you're moving forward in these changes. Go ahead, Jen.
No, sorry, I just can't see you. So sometimes I can't tell if you're speaking or not. I think, just to highlight sort of why we're talking about this, right? We're talking about why our change is so hard because we want to develop resiliency at a time like this. And when Daryl and I were sort of talking about doing this contract, and we were talking to some people on your administrative staff, one of the things we talked about was how, regardless of what the change is, whether it's in March when schools close down, going home and teaching from home, whether it is doing a hybrid approach, whether it's coming back to school full time, change tends to freak people out because we ask ourselves, like, am I ready to change? And one of the things I want to highlight on this slide, Daryl, because I think it's incredibly empowering, is this question, like, do I have the resources and knowledge to make a lasting change successfully? For all of the things in your lives, maybe not. For this, if we're talking about resiliency and coming back to the classroom, the answer is probably yes. And if not, you need to find the people in your life who can help you develop this. So I think the question is, like, where do I go to obtain the resources? Who are the resources? And where do I get the knowledge to make this change successful if I don't already know what that is? And sort of piggybacking off something you said earlier, Daryl, is this idea of, being able to ask for that and being able to say, I know what it is that I need. And if I don't know what it is that I need to be able to ask someone so that we can make this happen.
Right. Absolutely. And again, if you're working with kids as well, some of them might not be ready to change, but also asking them, what are their resources? Like, where can they go to help them get ready to change, or what would make them feel a little bit more comfortable to change? Right. This also kind of goes into, there are barriers to change. Things keep us from changing all the time. This could be physical things, Like I have to gear up in my ninja suit and my mask and my gloves ready to go. And I'm uncomfortable with it, or I have asthma or whatever in this pandemic kind of example, to barriers to change of this is how I feel about something. Or, you know, I have fear or anxiety about a change. So we're talking about lots of different things that make change hard come from the inside out a lot of times. And then there's always this likelihood to return to old behaviors.
Right.
If you're trying to be more positive, if you're trying to enter this school year with a different mindset, with a growth mindset, you know, very Angela Duckworth of us, of this grit and this mentality of moving forward and modeling grit behavior for our students, for our families, there's always that likelihood to return to an old behavior of being shut off, having kind of a limiting mindset. And that's okay. That doesn't mean you're not changing. It just means sometimes the daunting task of changing and thinking about the return to old behaviors makes change difficult. Change can happen. It doesn't mean that it's easy. I'm not saying that it's going to be easy, but definitely it will be worth it to change or to embrace change during this time. You'll feel a ton better than resisting it, kicking and screaming for the next 9 months.
Right. Things are changing whether you embrace it or not. So when we talk about resiliency by definition, right, we're talking about embracing that change so that the change works for you, right? If you do not embrace the change, it's going to happen. It's not going to work for you. It's going to run you over like a train. If you embrace the change, and again, that is not me saying that you have to skip into school next week, you know, like sniffing the air around children and saying, whatever, if I have to be around all these kids, I'm just going to be, that's not what I'm saying. Keep your 6 feet, keep your distance, but also like embrace the change so that the school year actually works for you.
Well said.
And stages of change, and I'm sure you guys have had this beaten into your brains in multiple classes, you know, in your undergrad and potentially grad school. So when we talk about stages of change, we're talking about Prochaska and his stages of change. We're going to talk a little bit about pre-contemplation, contemplation, preparation, action, maintenance, and relapse. We'll go through them fairly quickly and get to the bulk of our stuff after that.
So the way that we broke this down is to make it as succinct as possible. What characteristics are in each stage? What are the strategies to, if you're stuck in a stage, or if you see a student stuck or a family member, and also what are the questions to ask during this stage? So we wanted it to be as straightforward as possible for all of you who already know all of this stuff because you're brilliant. So stage 1 is this pre-contemplation. Basically, this is before you even decide to make a change. It's this denial of behavior or situation. It's completely ignoring that there is a problem. This might have been you in June. I'm not even thinking about this. I'm not even preparing for change. Some of the strategies of pre-contemplation, and I don't want to make this all pandemic based. There's going to be lots of changes of who you are as teachers, who you are as people throughout the year, but really rethinking behaviors. When we study neuropsychology, when we talk about brain and behavior, if you can understand how you're feeling and why you're feeling the way that you're feeling, and you can link it to behaviors, that is the most valuable thing you can do with your time in your life, I would argue. Because if you can understand why you do a thing that you do, if you rethink that behavior, you are better able to create a strategy around change and save yourself a lot of grief and a lot of worry. So you want to be mindful about your thoughts and behaviors and emotions. I know you're going to roll your eyes and you're all going to hate this, but too bad. Get a journal. Yeah. Journal things down. And this doesn't mean Dear Diary. This means I am going to set aside time to check in with myself. Jen and I work with an array of people, and the bulk of my caseload, I tend to work a lot with CEOs and executives. The most successful people that I work with have time built into their day to reflect, whether it's in the morning with their tea, whether it's at night before they go to bed, whatever it is, they make time in their schedule and it is blocked off to just check in. Again, it doesn't need to be more than 10, 15 minutes. This could be on your way to work, but ask yourself, how am I feeling? Where am I at today? And more importantly, what do I need? So you want to assess these challenges. You want to assess the risk of your current behaviors before there's even a problem, because this will keep you on top of things. This will keep you from burning out. This will keep you from potentially involving yourself in a bad habit that you later have to undo. So I would argue this is the best time is to get pen to paper, or set up some time with a counselor or a coach or a mentor or a family member that you trust, or time for yoga or reflection, whatever you want to do, but build in that time for you. And Jen, I don't know if you want to go through some of the questions to ask.
Well, and I was just thinking about, sort of a really benign example to use for this, I think, is sort of making this change to like positively embracing what this new school year is potentially going to look like. And that's just my example for these questions. But I think it's this idea of like, okay, so what changes are others implementing? So if you're noticing that some of your coworkers are doing really well with the change and you potentially are not, what are they doing that's allowing that to happen? If they're saying to you like, well, this is just how I'm trying, I've shifted my perspective, or I've spent time talking to this person, or I've read this, potentially implement some of that. Have you tried to implement this change in the past? Have you tried to be more positive entering the school year? What worked for you and what didn't? Not everything's going to work for you. Stop beating a dead horse. Get rid of the things that don't work for you and focus on the things that do. How do you know if there's a problem? So how do you know if you're potentially engaging in a backslide? And what would have to happen for you to consider a change to this? So do you need a coworker to say like, you are really negative? Or do you need people to start kind of avoiding you because talking to you is actually bringing them down and making it harder for them to accomplish their day? What do you need to happen for you to actually even see this? Because pre-contemplation is kind of this, and you know this, right? When we talk about stages of change, it's this place where we don't even really know there's a problem.
Right. And then we move into contemplation. And contemplation is this place where ambivalence comes up. In our world, we call it dissonance, feeling two ways about the same thing at the same time. So I can be excited to go back to school and dread it at the same time. And this is where conflicted emotions start to come in. And this is where we start to contemplate the change that we're going to make. I would argue that on a lot of levels, emotions are, we choose our emotions, or we choose our behaviors based on our emotions.
Yeah.
We can feel however we want to feel, but how we act is a choice. So I am not saying you're not allowed to have emotions or you're not allowed to feel. All of that is normal. We went through that at length in the beginning here. But what I'm saying is, in this contemplation stage, you have a choice. The strategies are weighing the pros and cons of a behavior. So again, in your reflection, if you're waking up in a bad mood and you have 15 minutes to reflect and you're just feeling just like dragon lady nasty, I want you guys to take a step back and say, what are the pros and cons of me continuing my day like this? I can never get this day back. What am I choosing to do with the rest of my day? And I want you to engage in these self-esteem tactics that really confirm your readiness and this availability to change. So I know, again, very corny, very therapeutic-y, but things like, I have a choice in how I proceed for the rest of this day. Or I have skills to not be a dragon lady for the rest, or man, dragon person, for the rest of this day. I have every capable tool in my toolbox. I am capable of using every tool in my toolbox to make sure I bully this day into being a good day for me. This is the type of stuff that we see with positive people. Positive people are not rainbows and sunshines and unicorn tears on butterfly wings. Positive people tend to make a choice about a situation, a realistic choice, that they are saying, I have a choice that I can go on this path and be negative and breathe fire, or I can choose to see what I can do and use the good with it. We know that positive people live longer. We know that positive people have better social interactions and better support systems. And we also know that positive people have stronger neurosynapses and the neurotransmitters of dopamine and serotonin. So they actually make their own happiness in abundance because they're choosing a tactic to be positive and to see the brighter side, or choosing a different way of thinking rather than giving into the emotion. So this is where this contemplation stage really comes in. Once these confliction of emotions start to come up, really stepping back and weighing those pros and cons and asking yourself, what choice do I have right now in how I continue my day, or how do I approach the situation?
Right. And I like what you said about this intentionality, and you and I use that word all the time, but influencers who somehow have become life gurus online have decided that, you know, this coined term of toxic positivity has got to go. I agree. No one is currently saying buckle up, buttercup. That's toxic positivity. When we are saying, like, you have the power to choose in your morning how, to an extent, your day goes, that is not toxic positivity. What Daryl is saying is, if you wake up in the morning and you're like, I'm in a bad mood because I went to bed thinking about this, it's like, okay, you have two choices. Well, three. One is you can continue to feel that way and potentially have a bad day. Two is you can address the problem from the night before and potentially deal with that so that you can move forward and have a good day. Or three, you can find a way to table that until later so that you can go to work and have a good day. So I certainly don't want to confuse this with toxic positivity, because that is not what we are saying. What we are saying is take control of the things you have control over, and the way you get out of bed in the morning, the way you approach the day, the people you choose to have lunch with at work, the people you choose to spend more than 15 minutes listening to them vent, you have control over that. So when you are contemplating making this change, those are also the things that you want to take into consideration.
Very good. I'm glad you brought that up. And then we move into preparation for change. So you've thought about change, you're getting there, and now you're preparing for the change. This is coming with experimenting with small changes. So it might start with blocking off 15 minutes in the morning to think, literally to think, and do nothing else, or to put on a podcast on your way to work rather than listening to really sad 90s R&B music that makes you cry. Whatever it is, this is the small step to preparing yourself for your day or for your change in your day. You're also collecting more information about change. We see this a lot of times with people who want to start therapy or coaching.
Right.
They start to ask around about it. They start to talk about it more with people that they trust. So these are really great ways to know that you're preparing yourself for change. It's also a really great way to propel yourself in a way to change by starting to consciously choose to experiment small and to engage in information gathering. Again, some of these strategies, and I'm very big on pen to paper, not because, you know, I guess because it's a personal preference, but also there's a lot of neuroscience that says that brain and behavior, when you take pen to paper, you are engaging in an entire brain process. You are taking what is in your head and you have to develop a name and an identifying factor for that feeling in a way that nothing else can be done the same way. So for instance, if you are feeling in a bad mood, unless you take pen to paper and you can identify why you're in a bad mood, it just feels like a feeling. You can also get this by talking it out to somebody, but I think writing down your goals, writing down, the things you need to do to gather information or change is a really important place and space to help, again, with healthy change, pushing you forward into a place that you want to be a little bit quicker and a little bit more succinctly. You also want to prepare for your plan of action. You want to gather your supports in this plan of action, who is going to rah-rah and cheerlead you on, because we all need that. And we also want to make a list of motivating statements. Again, it feels very fluffy, and I promise you, Jen and I are not fluffy people. I'm from Jersey. It's like the opposite of fluffy. But there needs to be something that motivates us. There needs to be something that allows us to keep going. And that's that inner voice. That's that grit that Ducksworth is talking about. That's that resilience piece. We need to have motivating statements for not only ourselves, we see it in our students and our kids as well, to help us reach a change as we're in this preparation phase, ready to kind of jump off the proverbial cliff.
Right. And I think when we talk about motivating statements, we also want to talk about like what your actual sort of motivation to yourself is going to be. So part of it is like, just like we give kids stickers for doing really well in school, we give them report cards and good grades when they do well. Just like you give your kids a little more at home, you may give your kids a little more screen time when they're doing well. You're also allowed to give yourself things for doing well, right? As much as I love what I do, I wouldn't be able to do it very long if I did it for free. So, you know, as adults, we get paid to do things. It's also okay to motivate yourself from a behavioral perspective in a very similar way. You are allowed to say, like, not only are these the motivating reasons I'm making the change, but these are the actual tangible things I'm going to motivate myself with. And it might be, I'm going to ask my significant other to take the kids for 2 hours on Tuesday night because I've been feeling like I've really been accomplishing things. I've been writing down my goals every day for a week. I've been reflecting. I'm going to ask my significant other to take the kids for 2 hours because I just want to take the most long, luxurious shower I can think of and just really enjoy myself for 2 hours.
That sounds lovely. And then we're in action stage. Action stage is the cool thing because you've done all like the, can I jump? Should I jump? What am I going to do to jump? And then you've actually jumped. This is you're moving towards a goal. And the goal might be, you know, from now until December, I am going to try to reframe, you know, negative thoughts about going to school. That's a goal. That's a change that can be made. So this is your direct action towards that goal. And like Jen is saying, you want to reward your success. We are creatures, we're creatures, first of all, meaning animals, where when we get rewards for the things that we do, it stimulates in the brain and that behaviors become solidified in something that is good or something that is worthwhile. You know, Pavlov dogs, bells, salivating type of thing. When we give ourselves that reward, our brain stores that as this feels good, so let me do it again.
Right.
So you absolutely want to reward yourself. Be careful with what it is, because again, you don't want those negative habits to come up. So if it's like, I'm going to have a drink, I deserve this, and you're, you know, 3 bottles in, maybe not so much of a reward as it should be. But it can absolutely be something, again, that's healthy for you, that makes you feel good, that contributes to the direction that you're trying to go. Cake, too. You want to be careful of, you know, eating a whole cake. You also want to seek out social support in this. Lots of research that shows that we're pack animals, so we tend to assimilate to a pack. And this is one of the most interesting things that I learned in psychology was if your pack tends to be more negative, your brain is going to start to acquiesce to the pack to fit in because you want to not be alone. The goal is to not be isolated because isolation means death in a very evolutionary standpoint. So you want to seek out social supports of the people you are trying to be like. You want to surround yourself with the people, of the teachers that you're trying to be like, the individuals who have attitudes that you admire, the parents that you tend to be more drawn to because of their exuberance or their health or their outlook. This will also make you a better person. And it's a very easy kind of life hack to understand who you're surrounding yourself with. And if you put yourself in a different situation with different people who are in a place or in a space that you're trying to get to, you are more likely to assimilate to that easier than if you are with people who are kind of holding you back or are engaging in the behaviors that you're trying to change from.
Right. And go, you know, if you're listening to what Daryl's saying and you're saying like, I can hang out with whomever I want and still sort of control my perspective, go back to your child development course that you took when you were 18 or 19. Infants smile at you and stick out their tongue when you do it, not because they're trying to be cute. They're trying to act like you so you will not abandon them. Right? Everyone's baby sticks out their tongue and all the moms are like, oh my goodness, they're so cute. Look at what they can do. It's actually quite sad because your baby's afraid you're going to leave it on the side of the road. I would never say that because that's why I would not get invited to hang out at your house anymore. I'm definitely thinking it for the record. But I wouldn't say it. But I think, you know, and we see this, I worked in the prison for a long time. We used to say to the guys when they got released, if you go back to the same social circle you came from, the likelihood of recidivism statistically is much higher. If you create a new social support system with individuals who are working full-time with you, who are going home and spending time with their significant other and their kids and their family, your likelihood of recidivism is much lower. So we know this is true. So if you are sitting here thinking like, I can hang out with whomever and I'll be fine, there is some brain science that you are unfortunately overlooking there.
Fair.
Poor babies. I know I picked on them.
Poor
today.
babies.
Poor babies. Poor new moms. Sorry.
So now we get into maintenance, and a lot of maintenance is continuing on the behavior. And this is a gift and a curse this stage, because you're there, you're doing it. And now it's the upkeep of continuing to do it. It's, that diet and exercise, you finally got into your routine. And then all of a sudden Thanksgiving's like, hey, and Christmas or the holidays are like, hey. So this is when how you maintain this new behavior and how to avoid temptation without, starving yourself of any joy. So how do you have a Christmas cookie or two, or, a holiday, a feast of sorts, and still, maintain your goals? So I would argue that maintenance is about understanding the elasticity and the flexibility of your goals and understanding the range that is important for you to have. What is too much and what is too little? And if you can understand that, then maintenance is going to be a whole new world of very easy for you. So some of these strategies are understanding coping with temptation. Doesn't mean don't do it. It just means at what point does it become unhealthy? How many fruitcakes are unhealthy? How much stuffing doesn't work for me? And these are very, this is low hanging fruit when we talk about diet and exercise. Right. This could also be, again, the behaviors that you're trying to change. How much am I looking at other jobs before it starts to impact how I do my job? Because I know I'm not leaving, I'm just looking at other jobs. Things like that. And you still want to reward yourself. In this maintenance stage, the stickers still need to come. Just because you're continuing to do it, and I'm sure you see this with your students, just because they're an A student doesn't mean you just leave them alone and they're good. There also needs to be that you're doing a great job. We need to parent our inner children, because at the end of the day, that's what we are. We're just big children. We also need those stickers. We also need to be told we're doing a good job from ourselves, but also from our supports. So this is a really great way to get your significant other or your support system, family, friends involved by letting them know what your goals are, so they can support you and they can say things like, I know you were trying to work out every day or spend 15 minutes with yourself every day. I've really seen an improvement. I'm very proud of you. We all need that, and there's nothing wrong with that.
And what's interesting is, as you're saying that, Daryl, I'm thinking there's definitely someone watching this right now who's saying, if I ever said that to my mother, or if I ever said that, then that's not your person. And if you can't think of a person who would healthily support you and by keeping you accountable, like, I thought you were going to work out every day. What happened to that? I thought you were trying to eat healthier. Why are you eating cheesecake? That's not your person. Go find yourself your person. So if you are listening right now thinking, I don't have that person, then I hope you took a screenshot of our contact information, because setting up a session with us is probably important. You need to find your person.
And this is also why we love animals, because animals give us that, like when your dog sees you and it's like, oh my God, I missed you so much. You're the best thing ever. Like, that's why we like animals. It's a little bit selfish in the sense of that unconditional love. People are much more complex.
I have to say, I'm really upset that I can only see the PowerPoint right now, because I feel like you just did an impression of a Labrador and I missed it. I feel like I know what it looked like, but I still missed it. And,
it was your dog. I did an impression of your dog.
It was probably.
And then we get into stage 6, which potentially happens, potentially does it. And this is this return to old behaviors, or what we would call relapse. And some of these characteristics are feelings of deep disappointment or frustration or failure. We know that relapses happen. It's not about avoiding relapse. That's not the goal. The goal is, if I return to an old behavior, can I identify the triggers that led there? Can I recognize the barriers that are getting in the way? And how do I reaffirm this goal and this commitment to change? So sometimes we see people who are so terrified to go back that they become, kind of, they're holding onto the steering wheel or white knuckling life. But again, relapse and what I would, quote unquote failure, I suppose it's really not, is it can teach us so much about ourselves. Why did I return and how do I make things a little bit better? So the next time that I attack this, I didn't unlearn all the things that I already did. I just need to tweak a few things moving forward.
Right. The average person trying to sort of stay away from relapse from a really dangerous behavior, so whether that's eating disorders or addiction or gambling, the average person enters treatment 7 to 8 times before they are able to maintain a healthy change. So in saying that relapse from major behaviors is obviously super easy, imagine how many times, if you're trying to be positive and you don't have to go to rehab every time, you've relapsed from that, probably hundreds. So I think what we're talking about is relapse is normal. It's part of the change process. Without relapse, you are being sort of naive to the change process. But it's really about what Daryl said, like feeling those feelings and saying like, okay, what didn't work for me? And, when we talk about the definition of insanity, right? Doing the same thing over and over again, expecting different results. It's the same concept. You cannot go back into this process with the exact same plan and expect it to end differently this time. So relapse is important because it allows us to look inside of ourselves, learn about ourselves, and figure out what worked and what didn't. It's really a restorative part of the process. And I really wish Prochaska, he's got to be like 104 by now, but I really wish he'd consider renaming it from relapse to something slightly more positively oriented.
I was thinking as you're talking, Jen, like how many times have all of us texted our exes or reached out to, people in our life that we need to let go of? And looking back, how much have we learned once we actually let go of that person? So it's the same thing. We don't send people to, like you're saying, we don't send people to rehab because they texted their ex or because they got off their diet.
You should go to rehab for texting your ex. I just want to throw that out there.
But again, this is something that should be embraced. And even in the classroom with our students, if you see somebody taking a step to the side or a step, I hate to call it back, but this is an opportunity, and seeing a return to behaviors as an opportunity to readdress and reevaluate.
I love this photo of us, by the way. I don't know exactly how you cut it out and did that, but
I don't know either.
I'm going to use it in my text messaging for the record.
And now we're kind of at the end of where we're at. And Jen and I just want to share some of these top 5 resilience factors that we personally have picked and decided that they're better than the others. So if your favorite isn't on here, I'm sorry. This is our list.
If you disagree,
that's our picture. So we get to say what we like.
Yeah, if you disagree, you need to turn your headshot into a tiny sticker and create your own resiliency factors.
Exactly.
Did you know it did that?
Yes.
Sorry, I got so excited. I just kept going along. Okay, go ahead.
All right, Jen, why don't you talk about emotional regulation? Because I know this is a good one.
So one of the things when we're talking about developing resiliency is we want you to learn how to regulate your emotions, right? Similarly to how we teach young children to do it. And it's interesting because most young children, I'm sorry, I don't know how many cans they are going to collect in front of my house today, but I didn't even know I had that many cans, so I apologize. One of the things is when we teach young kids how to regulate their emotions, right? Like safe hands, inside voices. I don't really know why that doesn't carry over to adulthood, but that's really something we need to work on. So first of all, you need to be self-aware, okay? You need to understand when your emotions need to be regulated. Something Daryl and I say to each other all the time when we are frustrated with usually staff, but something we will say to each other all the time is, I'm in my feelings right now. I need to sleep on this and not talk about it right now. Because we are aware that the decisions or the comments we are making to each other are fully rooted in how we are, what our current emotional state is. So if my current emotional state is annoyance, I'm going to respond accordingly. Now, if I'm able to sleep on that, It doesn't mean in the morning I'm less annoyed. It just means I'm potentially in a more emotionally regulated state, right? I've now slept 8 hours. I've probably had a cup of coffee. I'm just in a better place. And we need to be self-aware of where we are. So our emotional vocabulary, it's incredibly important that you are able to verbalize how you are feeling. Otherwise, you throw an adult tantrum, or for men, I call them mantrums. You throw these adult tantrums and it doesn't necessarily look the way your 3-year-old looks in Target when they don't want to try on shoes, but it can be actually more harmful. So if I am throwing a tantrum at a staff meeting, and I am making everyone feel as though their thoughts or their suggestions are invalidated, sometimes we need to be able to say, like, okay, this particular thing that we're talking about is causing some feelings for me. I'm feeling a little confused. I'm feeling a little frustrated. I'm going to sort of sit back on this and process before I kind of come in with a response, because there's a huge difference between a response and a reaction. And what we want to get in an emotional reaction is a response, and we need you to get there first. And intentional interventions. Daryl and I, if there's one word that's going to be on our tombstones, it's probably intentional. We say it all the time. You have way more control over your life than you give yourself credit for. And in giving yourself credit for that, you then have to own it. So there is a lot of things you can be incredibly intentional about. So for example, going back to the same example, if I am in a staff meeting and something is really getting me going, sometimes it's okay to say, like, I'm going to think about this. I definitely want to give you a response. I'm not entirely sure how I'm feeling. I feel, Daryl and I, we email each other this sentence at least once a week. I'm feeling multiple ways on this. That's our way of saying I love it and I hate it. So I'm feeling multiple ways on this. Just let me process for a few minutes and I'll have a response to you. Circle back to me. That's intentional. This idea of, I know that I'm emotionally not ready to just start, word vomiting at someone, because that's not going to get us to a good place. So I'm going to sit back, I'm going to process, and then I'm going to respond in a few minutes. And Daryl, any feedback on emotional regulation?
No, I love it. Great.
Go ahead.
So now we go into an emotional management. And emotional management is basically, once you figure out what's on the inside, you can start to manage the outside. So after you've named your feelings, after you've become super self-aware and have intentional interventions, now is, how do I manage my behaviors externally? So this is your coping skills. And this could be something as simple as, and we tell this with kids all the time, my mom says it all the time, if a kid is feeling a type of way, like insert water, that might mean a cold drink of water, not dunking them in a pond.
Or maybe.
Maybe, depends. Or taking a shower, but it also works for adults too. So a coping skill for if you're feeling really angry or flustered or sad, go hold some ice cubes, or go put, if you have popsicles in the break room, something really cold or very hot. I'll usually tell my clients, like, keep cinnamon gum with you or keep peppermint gum with you to help change, a feeling of hot or cold in your body in a certain way. So coping skills can be as tangible as that, of I need to go hold on to some ice cubes or splash water on my face and calm down, to a coping skill could be, I count backwards from 5, or I need to go take a breather outside so I can take my mask off because I'm going to fling a dry erase marker across the room. Whatever it is, this is what you decide to do when you are feeling a certain type of way to keep the behavior from not escalating. It is not a Band-Aid on a bullet hole. I don't want you to just be like, everything's fine, and then all of a sudden later on it blows up somewhere else or with someone else. This is to do something to diffuse it. So we're not slapping, glue on, something to keep it together. We're just trying to diffuse it, because later on you might need to process it more. Then you have emotional acceptance. Jen does a lot of work with DBT, which is dialectic behavior therapy. And one of the most important lessons in DBT is this radical acceptance of, sometimes it is what it is. How you feel about the pandemic is wonderful. It's how you feel about it. It doesn't change the fact that we are all sitting here preparing to go back to school. So how you feel about it is lovely, but the emotional acceptance is that school is happening. So at some point as well, having that overarching, and I hate this saying, mostly because my mom used it a lot as a child, but it is what it is. And that is the truest, worst thing, but it is what it is. And what can you do based on the reality of the situation? You can absolutely choose to leave your job, but if that's not what you're going to do, then how do you make this enjoyable? How do you not waste a year of your life being miserable because this is not what you want? It's okay that it's not happening the way that you want it, and all of those feelings are valid. But the facts are that school is starting on this day. These are the facts of the situation. You do have an opportunity to emotionally accept it and allow yourself some room to enjoy what you can with it. And that is the key to a happy life. And then we have things like CBT and mindfulness to help with emotional management. CBT is cognitive behavioral therapy. It is basically pulling apart how you feel and your thoughts on a situation don't necessarily need to result in a behavior. I can feel really annoyed and not lash out. And the process of that is basically a breaking down of, I'm allowed to feel annoyed. I need to put an intervention in place, which could be something like mindfulness, which could be something, like therapy. I have a place to go and talk. It could be yelling in your pillow before you leave in the morning. We don't judge. However you need to get there is how you need to get there. But definitely understanding that there are tools at your disposal, and you guys can email Jen and I after this if you're looking for more concrete things. But understanding this emotional management piece that plays in resilience, the facts versus the feelings, understanding how to pull apart how you feel versus what the situation is, and inserting things to make yourself feel a little bit more in tune and better, really, in a situation that's causing you discomfort is at a crux of resilience.
And I just, I want to be able to keep you guys on schedule. I know you have a full agenda today, so we're down to like the last 9 minutes. So I'll just keep that. I just want you to know we're aware of the time. So we also want to talk about perspective, and perspective is so incredibly empowering because it's so intentional. So first of all, describe and observe, or observe and describe the way you look at something. So if you are currently looking at school reopening with dread, or being around potential kids who are, infected or asymptomatic with fear and dread, observe that, recognize that it's happening, and then describe it to yourself. It's okay to say, like, I'm feeling uncomfortable. Like, I am feeling fear. So the first step in changing perspective is, one, really spending time recognizing what your perspective is and being able to verbalize that at least to yourself. The 5-year perspective. So we have the 5-year perspective. Sometimes I call it the deathbed analogy, but it's this idea of, like, will it matter in 5 years? If the answer is no, then sometimes that can be really empowering. I always say to my clients, like, will this be your thought on your deathbed? Which won't be in 5 years, for the record. But when you are lying in your deathbed, will your final thought be, I can't believe my neighbor put a fence 4 inches over onto my property line? Chances are that, listen, I'm saying that from personal experience. So, like, I didn't just so I get it. Super annoying. Stay on your property, Bob. But will I be thinking about that on my deathbed? Probably not. 5 years from now, will I be thinking about Bob putting his fence 4 inches over onto my property line? Only if I let myself. And that's where the power comes in. If I'm living here in 5 years and I am still upset about that, that is because I am allowing myself to perseverate and ruminate. There is intentionality in that. At some point, I can kind of go back to what Daryl said and say, it is what it is. Unless I'm going to hire a lawyer or I'm going to spend hours in civil court trying to fight this, I can. That's a choice. Do I want that? Or am I going to be able to let it go? What I can tell you is, if that is my last thought on my deathbed, then I've got some other things in my life I really need to sort out. Is this an emergency? So when we are saying, like, I feel uncomfortable, discomfort exists to tell us that something is wrong. However, now that we live in an era in which, we're not sleeping in caves at night, we're not being chased by bears for the most part, you probably won't be eaten by a saber tooth at night when you're sleeping around the fire. Our brain systems are relatively still the same. The threats are not, though. So sometimes things we think are an emergency or our body is recognizing as an emergency really isn't one. So take a step back and really ask yourself, is this an emergency? And if the answer is yes, then fair enough. Absolutely do something about it. And like Daryl said, that may mean you quit your job. That's an option. I'm not telling you to quit your job for the record. I don't want anyone coming at me after this saying we hired you and you told everyone to quit their job. I am not. But what I'm saying is you have an option. So if you are staying with your job, do what you need to do with it. Fix it the way you can. Implement the power you have. But if it's not an emergency, you got to let it go.
And then we go into optimism, right? And to highlight what Jen said before, this toxic positivity or toxic optimism is not what we're talking about. An example of toxic positivity is somebody tells you about something that they're going through and you say, this too shall pass. Everything, well, at least you're not dead. It's negating somebody's feelings.
Right.
But optimism and healthy positivity, it's recognizing the negative. It's understanding that there is a not so great side to this and honoring it in a way that it has its box. Going back after a pandemic is not the best thing that anybody would choose, but there's a time and a place for that. The optimism is there's so much we can learn from this year. There's so many cool technologies that's coming from this. There's so many great different ways to teach and to reach kids on a different level. So we can recognize the negative, but still see the other side in it. We also want to amplify the positive. Again, not to a toxic level of like, what pandemic? Everything is wonderful. That's ridiculous and nobody wants to be around you if you're going to do that. But you want to amplify the positive because if you have a choice to what to look at, I want you to choose what you see. You can look left or right. You have that choice. So if you can amplify the good things that can come from this year, the wonderful things that your students can learn about washing their hands, because I don't know, kids are kind of gross and this is kind of great because now they're a little bit more aware. So that's a positive. You can definitely choose to focus on things like that. Not only will it help you feel better on the inside, it will also permeate off of you into your classrooms, and it will also model behavior for your students as well. And optimism is also identifying context. If a kid is breaking down and they are terrified that they're going to die, this is not a time to say things like, everything's fine, you're fine, go back to class. It's saying things like, I can totally understand why you would be scared. This is scary, but what can we do right now to make you feel better?
Right.
Do you want to talk to the nurse? Do you want to look up stuff in the library together? What would make you feel better? So there is a context for optimism where it's not unbridled. We want to make sure that even in our own lives, if we're having a really bad day, we don't want to force positivity or optimism down our throats. We want to problem solve, and we want to identify the context and say things like, okay, I have an option here. I have a different way to think about it.
And we really want to focus on and rely on our relationships when we're talking about resiliency. They're important in our lives.
Probably the most important.
Yeah. Look at your social supports. Spend time really looking at who really builds you up in your life and who doesn't. One of the things I say to people all the time is, when we're young kids, we have a lot of seats at our table, right? So when you're in elementary school and you have a birthday party and you invite 25, 30 kids, and then you are friends with everybody on your soccer team, and maybe you have 3 or 4 best friends. In high school, you have a lot of people at your table, right? Like everyone's your best friend. In college, you have big groups of people. As we graduate college and really move into our lives, our tables get smaller and smaller. There's less seats. So here's the thing. If you do not build me up, you don't get a seat at my table. I don't care if we're related. I don't care if I've known you for 35 years. I don't care if we've worked together for 15. If you don't build me up, you don't get a seat at my table. There's not enough seats to go around. Communication. Communication when we are going through something is massively important. Talk to people about how you're feeling. But also, not only are we talking to people about how we're feeling, but it's also okay to say to people like, I want to be there for you. I do not have the emotional space for this right now. Like, how else can I help you? Do you want to come over and just grab a pizza and we'll watch TV together? Because I can be there for you in that way. I don't have the emotional space necessarily to listen to you vent for 30 minutes. Communication is important because it keeps our relationships honest and healthy. And boundaries. Boundaries are super important. And the example I just gave you is also a great example of a boundary. I love you. I can be your friend, but this is what I'm capable of right now. Or I'm so sorry I can't come to your barbecue. Unfortunately, I work in a school with hundreds of kids. I don't feel super comfortable being around people. I don't feel super comfortable being around your barbecue with 40 people I don't know and they're not wearing masks. Whatever your boundary is, you absolutely get to set it because this is what keeps relationships healthy. And people who push past your boundaries, don't forget, they are making a choice. They have now made a choice to disrespect you saying what you need in life and what you're okay with. So you feeling bad about reinforcing a boundary with someone, you shouldn't feel bad. You're reinforcing a boundary because someone made the choice to ignore yours. And also the environment. Know the environment you're in and the relationships you have around you and who's good for you and who's not. So that is not me saying that you post up at lunchtime and say, you can't sit with us. I'm not telling you to pull a Regina George. What I am saying is spend time around people who make you feel good. And the people who don't make you feel so good, minimize your interaction with them. If someone is trying to pull you into a contextually negative conversation, you're able to exit the conversation. I don't care if you have to lie and you have to say, oh my goodness, I have to run to the bathroom, it's an emergency. You have the right to exit the conversation. So surround your environment with people who make you feel good and really focus on, if my family does not make me feel good, and I don't mean your immediate family, but if you're thinking, I don't want to go see my aunts and cousins this weekend because they really tear me down and they're going to talk politics and they're going to go on and on about schools and schools reopening, don't go to that barbecue. You have the right to say no. Choose your environment. And any questions? I know we're about 2 minutes over, so you can also kindly ask us to log off if you'd like, or Daryl and I have time set aside where we can also answer some questions. And if there are any, or if you liked it, we'd love to hear that. If you didn't like it, we also like to hear that. So you can also shoot us an email. And I can't see anyone, so Daryl, tell me what's going on.
I don't see any questions in the chat, and the other folks that are watching via YouTube, I don't know, I can't see that, so I'm not sure if there's any questions there. So what we can do is if anybody has any follow-up questions, we can, maybe ask them to reach out and email you. We do have your contact information. Perfect. So thank you again. With that, I will thank you for being with us. We have to log off because now they're ready for the building level meetings. So thank you so much for being here with us. This was hugely helpful and relevant and important and, important information for us as we jump into this week and next week with the kids. So thank you so much.
Thank you for having us. Good luck. We are sending you good vibes.
Thanks.
Bye.
Take care.
Thank you for making me laugh when I didn't think I could.
Yeah. All right, everybody. We are over a few minutes. So thanks for your time. And I hope that was meaningful and worthwhile and gave you some things to go into the year with. So thank you. Have a great day. And I'll see everybody soon. Take care. Bye.
Thanks, Jess.